Hi, good evening everyone and welcome to OET Speaking Speculation Live. This is me, Caroline from Neethu's Academy. So joining you back on another Tuesday here at the same time, 5:30 p.m. back with another exam model card for you guys. So yes, I hope all of you are having a really good time and your preparation is going well as well. So yes, how are you all doing? I hope all of you are staying safe and healthy and you are preparing really well as well. Okay, so yes, good evening all of you. So for today also we have we are going to look into, we have come back with another exam model card discussion for you guys. So to say a few things about this card, this is kind of like a very familiar context. You might be already knowing this pattern because when you see the card, the structure, the tasks, the idea of the context and everything would look a little bit similar to you because it's kind of like a worn out topic. But this was recently asked. That's the main reason why I picked this context. Okay, ഇത് അത്യാവശ്യം കുറച്ച് നാളുകളായിട്ട് വന്നുകൊണ്ടിരിക്കുന്ന ഒരു പാറ്റേൺ ആണ്. ടാസ്കുകളുടെ ഓർഡർ ആയിക്കോട്ടെ, അല്ലെങ്കിൽ വന്നിരിക്കുന്ന ബുള്ളറ്റ് പോയിൻറ്റ്സ് ആയിക്കോട്ടെ, ടാസ്കുകളുടെ നേച്ചർ ആയിക്കോട്ടെ, അതിനകത്ത് യൂസ് ചെയ്തിരിക്കുന്ന ആക്ഷൻ വെർബ്സ്, കോണ്ടെക്സ്റ്റ്, അങ്ങനത്തെ എല്ലാ ഇൻഫർമേഷനും ഒക്കെ സിമിലർ ആയിട്ടുള്ള കോണ്ടെക്സ്റ്റ് ആണ്. ബട്ട് അറ്റ് ദ സെയിം ടൈം ദ റീസൺ വൈ ഐ പിക്ക് ദിസ് ഫോർ ടുഡേ ഇസ് ബിക്കോസ് this was asked recently for the examination. That's the reason why I have picked this particular topic. So yes, without wasting much time, let's start with the discussion. So over to the screen, you'll have 3 minutes to learn and prepare the card. Alright, welcome back everyone. I hope you got enough time to go through the context and prepare all the points that is needed to organize an entire card. So now let's have a look at this card together and read the major portions, and then let's start the discussion. Okay, so start reading with me. The setting is given as GP's clinic. And the background information says, you see the mother of an 8-year-old child who reports her son or daughter has been experiencing ear pain accompanied by fever. The mother is anxious and seeks advice. The child is not present during the consultation. First task, find out the reason for the visit. So when you see this much information or these points, the context is pretty much clear for everyone, I guess. It is not at all complicated. It is not having any sort of hidden details in it, which is pretty direct and forward. So could you guys please comment and let me know which context is this? From the setting, from the background information, from your task number 1, which context do you think this is? Let me know in the comment section, all of you. Yes. Yes, good evening, GB. Adira, good evening. Juliet, good evening. Yes, Ezekiel, very good evening to all of you. Let me know in the comment section, please, what context is this, and then let's start reading the rest of the task as well. So you can see the second task is explore symptoms in detail, which is information gathering task. You have to ask questions about temperature, duration, pain level, any discharge from the ear. Find out associated symptoms, cold or cough, loss of appetite, irritability, trouble sleeping, etc. So that task is entirely information gathering. Third task, explain possible common causes, which is information giving. You're giving information back to the patient. In the bracket, you can see common cold, ear infection, otitis media or ear wax buildup, foreign object, etc. Reassure the parent about the condition, common, no pus discharge, hearing loss, most ear infections improve within a few days. The next task is educate about home remedies and management. Paracetamol, warm compress over the ear, drink fluids, rest. Warn against common improper practices, inserting objects into ear, use of over-the-counter ear drops without GP consultation or approval. Find out any concerns or questions. And the last task, emphasize no immediate need for antibiotics. Severe bacterial infection not confirmed. Explain when to seek medical help. Fever persists beyond 48 hours. Pain worsens. Fluid leaking from ear. So these are the tasks that we have, and as I told you in the introduction, this context or this particular card is a very familiar nature. Alla ningalku bayangara familiar aayittulla taskkalum contextkalum ഒത്തിരി നിങ്ങൾക്ക് ഫെമിലിയർ ആയിട്ടുള്ളത് തന്നെയാണ് ഇതിനകത്തുള്ളത്. പക്ഷേ ഇത് വളരെ റീസെൻ്റ് ആയിട്ട് എക്സാമിന് വന്നൊരു ക്വസ്റ്റ്യൻ ആണ്. And if I'm not wrong, it was asked in the month of May, which is last month. So ഈ ഒരു പാറ്റേൺ ഒത്തിരി നാളായിട്ട് നമ്മൾ കണ്ടിട്ടുള്ള അല്ലെങ്കിൽ കുറേ ചെയ്തിട്ടുള്ള ടൈപ്പ് ഓഫ് ഒരു പാറ്റേൺ തന്നെ പിന്നെയും റിപ്പീറ്റ് ചെയ്ത് വരുമ്പോൾ ഇറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ് ദാറ്റ് യു ആർ ഫെമിലിയർ വിത്ത് ദറ്റ് കോണ്ടെക്സ്റ്റ്. യു ഗെറ്റ് ബാക്ക് ഓൺ ട്രാക്ക് ആൻഡ് പ്രാക്ടീസ് സിമിലർ cards as well. Okay, so yes, Adura, Suma, good evening. Isaac, yes, all of you have mentioned this is an unknown case. Excellent. Yes, this is an unknown case. We don't know anything about this particular parent or the child that is in the context. നമുക്കൊന്നും അറിയില്ല. So this has to be dealt like a new case. So that means you need to greet, you need to say who you are, then you can ask for the reason for the visit, or you can ask for the name and details, whatever, you can swap those points. In my case, what I'm going to do is after my introduction, I'm going to ask what can I do for you, or how can I help you, what is the reason for the visit, etc. And she says the reason. So after that, I'm going to give an assurance like, oh, don't worry, you have reached the right place, I'll give you all the information you need to know, etc. And my fifth step would be getting the details like the name and age and things like that after that point. So these are the steps that will be included for the intro part of my conversation. So I hope you guys also have practiced your introduction. So if you wish to type it down in the comment section, feel free to do that. Let me know in the comment section. Yes. So Suma, yes, good evening. I'm Suma, one of the registered nurses here. Please be seated. How can I assist you? Excellent. Yes, Lindsay, it is an unknown case. Very good. So that is how the introduction for this context can be. So now let's move on to the next point, which is explore symptoms in details. What is the word meaning of explore? Please comment. Explore. This is a very common action verb that you can see in your exam cards, etc. So yes, let me know, what do you mean by explore? It's a very common question, like in a common action verb you can see, and there are two ways in which this particular word can be found. The meaning is the same, but two types of tasks are usually incorporated with this action verb. So yes, what is it? Yes, Akhil, it's unknown case. Juliet, yes, it is unknown case. Very good. Let me know, what is the word meaning of explore? Anyone in the comment section, what do you exactly mean by explore? What is it? നിങ്ങൾ എക്സാം കാർഡ്സ് പ്രാക്ടീസ് ചെയ്യുന്ന സമയത്ത് മിക്കപ്പോഴും തന്നെ അതിനകത്ത് വരുന്ന ഒരു വാക്കാണ് കേട്ടോ എക്സ്പ്ലോർ. അപ്പോൾ നിങ്ങൾ ഫ്രഷേഴ്സ് ആരെങ്കിലും ഉണ്ടെങ്കിൽ, പുതിയതായിട്ട് കയറിയ ബാച്ചിൽ ആരെങ്കിലും ഒക്കെ ഉണ്ടെങ്കിൽ, make yourself familiar with this word, which is explore. And yes, Ezekiel, yes, Angel, the word explore means find out. Very good. Yes. So discovered, not discovery, discover. Okay, yes, okay. All right, so explore means to find out. Okay, so in this context, just replace the word explore there and put the word find out about symptoms in detail. That means you're going to ask questions to get the information from this particular parent. Okay, so what you need is, since you're moving to the next point after the intro phase and everything, the next one is a completely different topic. So what should you be doing? നിങ്ങൾ അവിടെ എന്ത് ചെയ്യണം? എന്ത് ചെയ്തതിന് ശേഷം മാത്രമേ നമുക്ക് ക്വസ്റ്റ്യൻസ് ചോദിക്കാൻ പറ്റുള്ളൂ? ലെറ്റ് മീ നോ ഇൻ ദ കമന്റ് സെക്ഷൻ what you need to do right after you say, oh don't worry, I'll do all these things, may I know your name, your daughter's name, etc. ആ ഡീറ്റെയിൽസ് എല്ലാം നിങ്ങൾ കളക്ട് ചെയ്തതിന് ശേഷം അടുത്ത ടാസ്കിലേക്ക്, സെക്കൻഡ് ടാസ്കിലേക്ക് പോകുന്നതിന് മുന്നേ, ഇതിന് രണ്ടിൻ്റെയും ഇടയിൽ what is required? Let me know please. Yes, Adira, Jubi, find out. Yes, explore means find out. Very good. Danya, yes, that's right. Chinchu, yes, find out means, sorry, explore means find out. Good. So good evening, I'm Adira, one of the registered nurses working in this clinic. Could you please tell me with your name, could you please help me with your name? Could you please tell me your name? Please tell me, what can I do for you? Okay, very good. Yes, Alfonso says general structure has to be given. Okay, that's correct. Yes, general structure needs to be given. But right before you ask questions, what should you do? My question is not just about general structure, because that is something the students of Neethu's Academy get trained to, which is not kind of like a very familiar concept for everyone. So I'm not particularly talking about the general structure. I'm talking about what you need to do right in front of your questions or your information gathering task. Transition. Okay, can you tell me what transition exactly are you referring to, Ezekiel? There is another word for it. Arya, yes, it is unknown case. Jovit also mentioned general structure. Yes, I totally understand where this is coming from. But still, I'm asking about what exactly needs to be done before you ask questions. Yes, this is a part of your assessment criteria. This has to be done. This is a point that they have clearly mentioned in the list of providing structure, which is one of the criteria that you have, and you can see this among the 3 points that is mentioned under that particular criterion. So yes, can you please tell me what that could be? So Suma, from what you just told me, I understand that the child has fever and pain, then initial assurance, then find out the name of the child, find out mother's name. Yeah, that is intro phase. Excellent. Ezekiel, that is for the next task, isn't it? Do you have any idea about the common causes? No, common causes is the third task. We are still discussing the second task, but that sentence is absolutely correct, okay? Fine, so let me just tell you what that is. It is nothing but signposting statement. Okay, what do you mean by signposting statement? What is it? Signposting. Please comment. Signposting. I'm pretty sure most of you would be familiar with this context, this word and this context. So yes, what do you mean by signposting? Signposting. And signposting is very much important, not just before you ask the questions, also whenever there is a change in topic, even if you have given the general structure, okay? So yes, what is signposting? Anyone in the comment section? What is signposting? So Adra has given another statement. Okay, Mrs. Susan, I totally understand the reason behind your visit. Please don't worry, you have reached the right place. I will do the needful for you. Moving on, I would like to get some information about your child's condition. Excellent. Yes. That moving on, I would like to get some information about your child's symptoms is the right question. Not condition, it's the symptom. Okay. Jibi, could you please tell me, or let me ask you, I would like to ask you. Excellent. So you need to inform the patient or the parent or the bystander that you are going to ask questions before you get into the questions. Okay, so you need to say, moving on, I need to ask you some questions about the symptoms your child has been experiencing. May I? So now if you have the habit of giving general structure, if you say that, it will be like, okay, so moving on, I'll be asking you some questions, and after that we'll discuss the common causes, and in between if you have any questions, feel free to ask me. എന്നായിരിക്കും നിങ്ങൾ general structurally usually ഇത് പറഞ്ഞ് ശീലിച്ചിട്ടുള്ളവർക്ക് മാത്രമുള്ള കോണ്ടെക്സ്റ്റ് ആണ് കേട്ടോ. സോ ഇഫ് യു ആർ നോട്ട് എ പേഴ്സൺ, യു ഡോണ്ട് സേ ദാറ്റ്, ഇറ്റ്സ് ആബ്സൊല്യൂട്ട്ലി ഫൈൻ, ഡോണ്ട് ബി ബോതർഡ് അബൌട്ട് ഇറ്റ്. സോ ഇങ്ങനെ പറഞ്ഞതിന് ശേഷം what you have to do is, so now about the symptoms എന്നുള്ള രീതിയിൽ ഒന്നുകൂടെ പറഞ്ഞിട്ട് വേണം, അല്ലാതെ ഒന്നുകൂടെ പിന്നെയും now can I ask you some questions about the symptoms എന്നുള്ള രീതിയിൽ ചോദിക്കേണ്ട. കാരണം ഓൾറെഡി പറഞ്ഞു മൂവിങ് ഓൺ ഐ ബി ആസ്കിങ് യു സം ക്വസ്റ്റ്യൻസ് അബൌട്ട് ദ സിംറ്റംസ് ഓഫ് യുവർ ചൈൽഡ് എന്ന് ഓൾറെഡി ജനറൽ സ്ട്രക്ചറിൽ പറഞ്ഞിട്ടുണ്ട്. അങ്ങനെ പറഞ്ഞിട്ടുണ്ടെങ്കിൽ പിന്നെയും അത് റിപ്പീറ്റ് ചെയ്യുന്നതിന് പകരം what you can do is you can say, okay, now coming to the symptoms എന്ന് പറഞ്ഞിട്ട്, അല്ലെങ്കിൽ സ്പീക്കിംഗ് about the symptoms or now about the symptoms എന്നൊക്കെ പറഞ്ഞ് ജസ്റ്റ് ഒരു ഇൻഡിക്കേഷൻ കൊടുത്തിട്ട് മാത്രം ആ ക്വസ്റ്റ്യൻസ് ചോദിക്കാം. ഇനി അങ്ങനെ നിങ്ങൾ ജനറൽ സ്ട്രക്ചർ പ്രൊവൈഡ് ചെയ്ത് കറക്റ്റ് ആയിട്ട് ഓർഡറിൽ പോകുന്നതാണെന്നുണ്ടെങ്കിൽ what you can do is, after you say, please don't worry, okay, may I know the name of your child, may I know her age, may I know your name ഒക്കെ ചോദിച്ചതിന് ശേഷം പറയാം. So Miss Susan, moving on, I need to ask you some questions about your daughter's symptoms. Is that okay with you? That's it. And then you can start asking the questions. Okay, so now the questions are temperature, duration, pain level, any discharge from the ear. So you have 4 points. So what you can do is, either if you are kind of like a person who can manage time no matter how big the card is and things like that, you can ask each point separately, which is advisable. But if you can't, then I would suggest you to club 2, not more than that. Okay, because a person won't be able to reply to all the questions if it is asked at once. So remember to just club 2 questions, like does he experience any temperature, and also could you please tell me how long he has been experiencing that. So that means it is temperature and duration asked together. Okay, so that is how you can club these points. All right, yes, GB, transitioning between topics, introducing new idea, that is called signposting. Yes, excellent. So moving on further, firstly I will ask you some questions. Okay, over there you need to add one more point. Okay, so moving on further, firstly there is no connection between these two words. Okay, further and firstly. So what you have to do is, moving on further or moving on, you don't have to add that further word there too, because moving on means further. Okay, moving to the next point. So you can say, moving on, I will tell you what we are going to do next. First, I will ask some questions. So you need to just say, I will tell you what we are going to do next. Okay? And then you can add, firstly, I will ask you some questions regarding your child's symptom. It's not condition. Okay? All of you look at that second task. You can see the word and explore symptoms in detail. Okay. Juliet, provide general structure. Okay, and after the general structure, you need to signpost as well. Okay, all right. So that is about the second task. Temperature. How do you ask whether the patient, the bystander, whether the daughter has temperature? Bystander node കുട്ടിക്ക് ടെമ്പറേച്ചർ ഉണ്ടോ എന്ന് എങ്ങനെയായിരിക്കും ചോദിക്കുക? Let me know please. Draft a question all of you. Yes, draft a question for temperature, and you're talking to the mother. Okay, don't forget that. How would you ask about a third person? So in this context, the third person is the patient, because we are not conversing with the person who is ill. So how would you draft the question to the bystander? Yes, about temperature, how is it going to be? Yes, everyone. How do you normally ask that question? Angel Alex has mentioned, does she or he experience any temperature? Excellent. So when it is the third person singular, you can use does. And depending on the daughter or son category, you can select the he or she. Then you can use the word have or experience and the question. That is, in this context, it is temperature. Good. Suma, does your child has temperature? Okay, Suma, the question is brilliant, but just one correction. When it is does, do not use has in the sentence. Okay, when it is does, it will be have. Always remember this point. Okay, just remember like does and have. It is not has. Okay, does she have or does he have? You do not ask does he has, which is wrong. Okay. GB, does your child experience any fever? Excellent, good question. Yes, so that is how we can ask the question does. Okay, that is the first question. The second one is duration. How would you ask that one? Duration, you need to know about the issue, the fever, the issue that the patient has, and how long the patient has had that. So how would you know the duration? What is the right question to ask about the duration? Duration എങ്ങനെ ചോദിക്കുക? Yes, how would you ask regarding duration of pain? Does your child experience temperature is the first question from Adira, and Jubi used what about the duration? Okay, so what about the duration of fever? Okay, just be more clear there, and you can use that. Yes, brilliant, good job, Jubi. Ezekiel, does he having experienced temperature? Okay, it's not having, Ezekiel. Does he have temperature? If you're using have, then don't use experience. Okay, does he have temperature or does he experience fever? Like, does he whether your child has been experiencing any fever? How long he has been experiencing the fever? It should be has been. Okay, how long he has been. Good. How long does she have the temperature? Very good, excellent question. So duration can be simply asked like, may I know how long she has been experiencing the fever or suffering from the fever or experiencing these problems? What is the duration of the temperature? Okay, yes, that's also very direct. What is the duration of the temperature? Now the next question, does he experienced any temperature spikes? Okay, that's good. Our experienced does he experience any temperature spikes is a very excellent question. You don't have to use experienced because does is a simple present tense format, so don't add the past tense verb into that. So does he experience any temperature spikes? Excellent. Jubi, how long does he or she have the temperature? How long does he or she have the temperature? Yes, correct. Good job. So the next one is pain level. So it is not clearly given in this bullet point which pain level they are referring to, but in the background information it is mentioned which pain level it is or which pain they are talking about. Which is the pain they are talking about here? എന്ത് വേദനയെ പറ്റിയിട്ടാണ് അവർ സംസാരിക്കുന്നത്? Which is the context they are referring to? Yes. In the task you can simply see pain level, but you can't see about which pain level or about what and on extra mentioned alla. So yes, which pain level അല്ലെങ്കിൽ എന്തിൻ്റെ വേദനയെ പറ്റിയിട്ടാണ് അവർ സംസാരിക്കുന്നത്? Yes, what is it? Let me know. You can see that information in the background details. So read the background information and let me know which pain they are referring to. First, let me know which pain they're referring to, and after that, let's discuss how we can construct statement for that, okay? Yes. They're talking about which Posh? Yes, they're talking about ear pain. Excellent. Yes, from the background information, you can see it is mentioned as the child has been experiencing ear pain accompanied by fever. Yes, GB, Sweetie, Isaac, 𝐒𝐸𝐸𝐵INC. Yes, Angel, Anisha, all of you got it right. Yes, it is ear pain and CG high. So yes, so now you need a connection from this point to this point. So how would you say that you're asking question about the pain, about the ear pain? How would you mention that in a sentence? Ear pain ne pattiyanu chodikkunnathu. Appo ear pain endorum undu ennulla reethiyil engane adum kuttikku endorum undu ennulla reethiyil engane question draft cheyan pattum? Please comment down. General body pain due to fever. Okay, 𝐒𝐸𝐞𝐚, it is not the body pain, it is clearly mentioned ear pain. So that is the point there. Could you please tell me about the duration of temperature spikes? Okay, they are not actually asking the question about the temperature. The duration means fever etra naalaayittundennulla question aanu. So could you please tell me about the duration of the fever? Would be the right question. Yes, how would you ask this point? Pain level engane chodikka? Let me know, please. Yes, Adira, it is ear pain. How would you rate a question? How would you frame a question there? How would you draft it? Suma has asked a question for the next point, discharge from the ears. Have you noticed any discharges from his ear? Okay, that's absolutely correct, but I need this portion. How would you connect the ear pain information mentioned in the background detail with this pain level which is given here? What is the connection there? How would you draft it into a question and create a connection? How would you do that? So imagine the mother's name is Susan. So let me just take you through that. Okay, and imagine the child's name is Troy. Okay, so these are the names. So you can say like, so Miss Susan, you told me that Troy has been experiencing ear pain. So has he mentioned anything about the pain, like how severe it is? That could be the question there. I'll just repeat that. So Miss Susan, you mentioned that he has been experiencing ear pain, and if you want you can use this entire sentence, okay, starting from here. You told me that he has been experiencing ear pain accompanied by fever. So could you please tell me whether he has mentioned anything about the level of pain, like how severe it is? Okay, could you please tell me whether he has mentioned anything about the pain levels, like how severe it is? That is the question. This is how we can club it with the information that you have here. Okay, so that is how we can do that. I hope you got the idea and you got how to do that. Alright, so now the next is any discharge from the ear. Is as always you can ask have you noticed any discharge from the ear, or does he have any discharge from the ear, etc. can be fine. The next is find out associated symptoms. How would you frame a question for this topic statement? ഈ ടോപ്പിക് സ്റ്റേറ്റ്മെൻറ്റിനെ എങ്ങനെ എക്സ്പാൻഡ് ചെയ്യാൻ പറ്റും? Angel, how long your child have been experiencing? Okay, your child is singular, so it is not have, it has to be has. How long your child has been experiencing ear pain is a good question. Jibi, could you please tell me about the intensity of the ear pain for him or her? Okay, you cannot ask that question to the bystander because the bystander won't be able to tell you that. Okay, so you need to use it or draft a question where it should be like whether the child told you anything about the pain, or whether he mentioned it is really bad, or how the time, what is the nature of the pain, etc., etc. So you need to use that particular topic or that particular type of information to draft the question. Suma, you mentioned that the child has ear pain. Yes, very good. That's how the connection can be built. Jovita has mentioned how is your child's ear pain. Okay, yeah, so how is your child's ear pain? That is good, but there is no connection there. It's kind of like a distant question. How is your child's ear pain? Okay, so you have to ask, so can you tell me the pain levels? Okay, can you please describe to me the pain levels of Troy's ear pain? That could be fine. Or has Troy mentioned anything regarding the level of pain he's experiencing? Could be another great question. So always mention that, make sure that your question that you're trying to ask, when it is a bystander, the question has to have a direct connection with the context that you're dealing with. Okay, now irritability. Okay, now next is associated symptoms. So I would like to know whether he has any other symptoms like cold or cough, loss of appetite, irritability, trouble sleeping. So again, what you can do is you can ask this together, cold and cough, loss in appetite separately, irritability and trouble of sleeping together, or however you want to mix and match, no problem at all. Okay, so I just told you how it will be easier for you to do, but if you have another way of doing that together, that is also fine. Okay, yes, Jibi, as you mentioned that your child has ear pain, please tell me how severe it is. Excellent, that's a very great and simple way of doing it. Beautifully done, good job, Jibi. Akhil, on a scale of 0 to 10 from low to high pain score, will you be able to tell me the intensity of the pain? Okay, Akhil, this is a great question. If it was the patient that you are talking to, നമ്മൾ പേഷ്യൻറ്റിനോട് തന്നെയാണ് സംസാരിക്കുന്നതെങ്കിൽ this is an excellent question. Very beautiful sentence construction, but in this context നമ്മൾ അവരോടല്ല ചോദിക്കുന്നില്ല. So she won't be able to rate the pain because she is not experiencing the pain. It is the child who is experiencing the pain. അപ്പോൾ നമുക്കത് ഡയറക്റ്റ് ആയിട്ട് പെയിൻ സ്കെയിൽ ചോദിക്കാൻ പറ്റില്ല. നമുക്ക് സിവിയർ ആണെന്ന് പറഞ്ഞോ, എത്രത്തോളം ബാഡ് ആണ്, എങ്ങനെയാണ് പെയിനെ പറ്റി പറയുന്നത് എന്നൊക്കെ ചോദിക്കാൻ പറ്റുള്ളൂ. So that question is great. You can use that when you're talking to the patient yourself directly. പക്ഷേ ഈ കോണ്ടെക്സ്റ്റിൽ it is not possible. കേട്ടോ, but great statement. I have to repeatedly tell you that's a great sentence construction. Then yes, Jovita, how is your child's ear pain? Okay, Jubi, as mentioned, yeah, I read that. Isaac, as you said earlier, okay, it is not said as you told earlier. As you told earlier, your child is experiencing ear pain, so could you please tell me whether he described the level of pain? Excellent. Isaac Bina, that's great. I hope you're Isaac or Bina, I don't know, but it's given Isaac Bina. So yeah, that's great. Amazing sentence. That's a great statement. You can definitely use that in this context. Akhil, as you aforementioned the pain of your child, could you please tell me about the severity of pain he experienced? Great. Very beautiful statement. ഇതേപോലത്തെ സ്റ്റേറ്റ്മെൻറ്റ്സ് സംസാരിക്കുന്നുണ്ടെന്നുണ്ടെങ്കിൽ, but if you're incorporating these in your speaking, you're doing exceptionally well. Great. Okay, those words are really very nice. As you aforementioned the pain of your child. That means നേരത്തെ പറഞ്ഞതുപോലെ നിങ്ങളുടെ കുട്ടിക്ക് വേദനയുണ്ടെന്ന് നേരത്തെ പറഞ്ഞല്ലോ എന്നുള്ള രീതിയിലൊക്കെയുള്ള സ്റ്റേറ്റ്മെൻറ്റ്സ് ആണ്. സംസാരിക്കുമ്പോഴും ഇതേ ഫ്ലുവൻ്റ് ആയിട്ട് തന്നെ സംസാരിച്ചാൽ it will be really nice കേട്ടോ. Okay, great. So I loved all the statements. The next one, let's look into the next point, associated symptoms. So I hope you guys know how to construct the statements for those as well. Yes, Suma, from what you just told me, I understand that the child has been experiencing fever, earache, and you notice some discharges. Am I right? Discharge illa nanu parnadu ട്ടോ. Just imagine there is no discharge. Okay, am I right? Yes. Would you like to add anything to this, like any other symptoms such as cold or cough? That's a really nice transition. That's beautiful transition. I love the way you clubbed it together. Excellent. Okay, what about his appetite? After you use the statement, you can use what about his appetite? Has he been really irritable, or has he does he have any trouble sleeping? Has he been irritable, or does he have irritability or trouble sleeping? That will be also very easy to ask. Does he have irritability or trouble sleeping? Okay, Adira, it is you mentioned. Okay, mentioned you mentioned that he has been experiencing ear pain accompanied with fever, or accompanied by fever. Could you please tell me how severe it is? Excellent. Okay, so that is how we can complete the first two tasks. I hope all of you got an idea about it. So let's quickly move to the task number 3 here. Explain possible common causes. So once you have completed task number 2, what you need is you need to summarize the collected information. So say for example, it can be something like, thank you very much for answering all the questions. So from what you told me, I understand that your child has been experiencing fever for the past couple of days, and along with ear pain, which is rated as severe pain, and you did not notice any discharge from the ear, but he has a cold and cough. He's not eating well, he is irritable, and also he has trouble sleeping at night. Am I right? So just imagine these are the information that you got, and that's how you just concluded the summary, and you will ask the question, am I right? And you will get the confirmation from the parent here. Okay, so now you need a transition to the next point. You need to transition to the next point, which is explain possible causes. Okay, possible common causes. So what we need from the end of here to the beginning of here is a transition. Okay, we need a transition. So you can use a connector. Okay, so moving on. Or you can use a very nice usage, which is having said that. Or in this case, since there is a question like, am I right? And the parent would reply, yes, you are right. You can try, instead of having said that, this is also good. Instead of that, you can also try, well, in that case. അങ്ങനെയാണെങ്കിൽ, well, in that case, I would like to discuss the possible common causes of the symptoms your child has been experiencing. It can be because of common cold or ear infection, or it can be even because of earwax buildup or the presence of foreign object in the ear. But please do not worry. If it gives you any peace of mind, I can assure you that this is very common in children. And you told me there is no pus discharge, and I assume that he's not having any hearing loss as well. So most ear infections will improve within a few days too. So there is nothing for you to be worried about. In the Paranita, you can wind up this. Okay, so but always remember this point whenever there is reassure. Okay, I'm not saying it is a must thing to do, but if you want to show that you have good proficiency and you can speak very naturally, and you know you have something in stock like the vocabulary and the expressions, the idiomatic speech and everything, if you want that, you can just add this point. So whenever it is reassure, just add this point. If it gives you any peace of mind. If it gives you any peace of mind, I assure you that. I assure you that. And then you can just go on with whatever details you have here on the card. And then once you finish it, you can just ask the question. So is that clear to you? I hope you understand, etc, etc. Okay, so that is how we can complete task number 3. So yes, Suma, thank you for providing all the information. You will do the back channeling. Okay, excellent. Suma, moving on now, let me tell you the possible causes. Excellent transition, Suma. Great. Angel, it's my duty to explain the common causes of your child has been. Okay, common causes as of why your child is experiencing these problems. Correct? Or as of why. Then Adira, thank you for answering my questions. From what you told me, I understand that. Excellent. That's a great part of the summarizing portion. Okay, so now let's look at task number 4, which is educate about home remedies and management. So what you can do is, since ഇവിടെ നമ്മൾ ഇതിന് മുന്നേ ഒരു ട്രാൻസിഷന് കണക്ടർ യൂസ് ചെയ്തത് കൊണ്ട്, so in this transition from this point to this point, let's ask a question. Okay, and that question can be, do you have any questions to ask me? Is there anything you would like to talk to me about? Do you want me to clarify anything else to you? Would you have to ask me anything else? എന്നുള്ള രീതിയിൽ you can ask any general question, so that definitely the patient would be asking you, yes, so is there any home remedies I can try, or what can I do about this particular condition, or what is the next thing I can do about it? How can I rectify this problem? അങ്ങനെ പല questions ചോദിക്കാം. So basically the question will be definitely focusing on to the management of the problem that the child has right now. So how are you going to do that? First, you definitely need to acknowledge the portion. So you'll say, well, I totally agree with whatever concerns you have, or I understand that you've been really concerned about how to take care of the situation or how to manage the problem. So let me talk to you about that. So there are certain home remedies and management that you can try. Starting with the medication, to ease the pain, paracetamol is a good option, and you can apply warm compress over the ear, which would help her with the pain, and also ask her to drink a lot of water. Okay, or increase the fluid intake. So this will definitely make her feel better. At the same time, it is important that you stay away, or that you refrain from improper practices, like don't let her insert any objects into the ear, or don't use any over-the-counter ear drops without talking to your general practitioner first. Okay, so that is how we can club it both together. Okay, so let me just go through that statement one more time, starting from educate. So I understand you have some questions about the home remedies and the management of the situation, so let's talk about that. Starting with the medication, paracetamol is a good option for the pain. At the same time, you can apply warm compress over the ear. It will also help to ease the pain she experiences, and ask her to increase the fluid intake. At the same time, it is important that you monitor her from not putting anything inside, or any objects inside her ear, and please do not use any over-the-counter ear drops without talking to the GP first. So I hope you will take care of these. So is that clear to you? And that point is done till here. So the parent would say, yeah, absolutely, I'll take care of that. So what is the next point? Find out any concerns or questions. So since that is the second last portion, you can ask, do you have any other concerns? Because that is towards the end, you're going to wind it up. So yes, she would say like, okay, so can you put her on some antibiotics, like instead of the home remedies or paracetamol? It would be good that if you start her or put her on an antibiotic course. So your point is no immediate need for antibiotics. So first of all, you need to acknowledge the mother's curiosity, or the problem that she is facing right now. She just wants her child to start to feel better. That's the reason why she's been urging to start the antibiotic course. So what you can do is, well, Susan, I totally understand where this is coming from, or I totally understand why you say that you need to put her on antibiotics. But let me tell you, given her situation, there is no immediate need for antibiotic, because severe bacterial infection is not yet confirmed. So we do not need to put her on antibiotic course. The normal medication and the instructions that I've told you will suffice. Will suffice means adu madi. will suffice. അത്രയും മതി എന്നുള്ള കോണ്ടെക്സ്റ്റ് ആണ് കേട്ടോ. However, പക്ഷേ അങ്ങനെയൊക്കെ ആണെങ്കിലും it is important that you know when to seek medical help. So if the fever persists beyond 48 hours starting today, and if the pain worsens, or if there is any leakage or discharge from the ear, so please make sure that you contact the doctor at the earliest. That is how we can do it. So if you have noticed, let me erase everything and then just discuss that point with you. I try to connect two tasks together. Okay, starting from this point, ഈ ഒരു ടാസ്കിൽ, നാലാമത്തെ ടാസ്കിൽ ഇവിടുന്ന് ഈ ഒരു പോയിന്റിലേക്ക് കണക്ട് ചെയ്യാൻ I just used, okay, I'm just writing it here, okay, I just used at the same time. Okay, and in this task, ഈ emphasize in ഈ ടാസ്കിൽ ഈ ഒരു പോയിന്റ് എൻഡ് ചെയ്ത് ഈ എക്സ്പ്ലെയിൻ വെൻ ടു സീക്ക് എന്നുള്ള പോയിന്റുമായിട്ട് കണക്ട് ചെയ്യാനായിട്ട് I used however. ഓക്കെ, സോ ഇവിടെ രണ്ടിടത്തും നിങ്ങൾക്ക് കാണാം ഒരു പോയിന്റിൽ എന്തൊക്കെയാണ് ചെയ്യേണ്ടതെന്നും എന്തൊക്കെ ചെയ്യരുതെന്ന് പറയുന്ന പോയിന്റാണ്. ഈ ഒരു പോയിന്റിൽ ആൻറ്റിബയോട്ടിക്സിൻ്റെ ഒന്നും ആവശ്യമില്ല, പക്ഷേ എന്തെങ്കിലും പ്രോബ്ലം ഉണ്ടെങ്കിൽ വരണം. അപ്പോൾ രണ്ടും ഓൾമോസ്റ്റ് സെയിം ആണ് അല്ലേ? Do you understand the context? So രണ്ടിലും ഒരു പോസിറ്റീവ് കാര്യം പറയുന്നുണ്ട്. പോസിറ്റീവ് ആസ് ഇൻ there is one kind of like ഒരു ഡു എന്നുള്ളൊരു പോയിന്റും ഒരു സ്ഥലത്ത് ഡോണ്ട് എന്നുള്ളൊരു പോയിന്റുമാണ് വരുന്നത്. അതുപോലെ തന്നെ ലാസ്റ്റ് ടാസ്കിൽ ഇപ്പം അതിൻ്റെ ആവശ്യമില്ല, പക്ഷേ ഇങ്ങനെ വന്നാൽ നിങ്ങൾ വരേണ്ടി വരും. അപ്പോൾ രണ്ടും രണ്ട് ടോപ്പിക്കാണ്, പക്ഷേ ഒരുമിച്ച് പോവുകയും ചെയ്യുന്നുണ്ട്. ഓക്കെ, സോ ഇങ്ങനത്തെ കോണ്ടെക്സ്റ്റുകളിലൊക്കെ യു ക്യാൻ യൂസ് ദീസ് ടൈപ്സ് ഓഫ് വേർഡ്സ് ടു കണക്ട്. ഓക്കെ, അറ്റ് ദ സെയിം ടൈം ഇവിടെയും അത് ആപ്ലിക്കബിൾ ആണ് കേട്ടോ. ഇമ്മീഡിയറ്റ് ആൻറ്റിബയോട്ടിക് വേണ്ട. I hope you understand that, but at the same time let me tell you it is important to seek medical attention എന്ന് വേണമെങ്കിൽ അവിടെയും പറയാം. So this can be used to here and this can be used here as well. മാനേജ്മെൻ്റ് ആണ്, ഫ്ലൂയിഡ് ഒക്കെ കുടിക്കണം എന്നുള്ള കാര്യം എന്ന് പറയാം. സോ ഇവിടെ പക്ഷേ രണ്ടും രണ്ട് ടോപ്പിക് അല്ല. Okay, so that's the reason why, sorry, this can't be used here because ഈ ഒരു ഒറ്റ ടാസ്കിൽ ഈ രണ്ട് ടോപ്പിക്ക് ഡിഫറെൻ്റ് അല്ല. ദേ ആർ ദ സെയിം പോയിൻറ്റ്സ് ആണല്ലോ. കാരണം എന്ത് ചെയ്യണം എന്ന് അങ്ങോട്ട് പറഞ്ഞു കൊടുക്കണം, അതുപോലെ തന്നെ എന്ത് ചെയ്യരുതെന്ന് പറയുന്നത് രണ്ടും ഇൻഫർമേഷൻ ഗിവിങ് എന്ന് പറയുന്ന പോയിന്റിലും അല്ലെങ്കിൽ അഡ്വൈസ് എന്നുള്ളൊരു കാറ്റഗറിയിൽ വരുന്നൊരു കാര്യമാണ്. ഇവിടെയും അത് തന്നെ വരുന്ന പോയിന്റ്സ് ആണ്, പക്ഷേ ഇവിടെ രണ്ട് എന്താ പറയുക ഡിഫറൻസസ് വരുന്നുണ്ട്. നമുക്ക് അങ്ങനെയൊന്നും വേണ്ട, ഇപ്പോൾ തന്നെ മരുന്നൊന്നും കഴിക്കേണ്ട ആവശ്യമില്ല, പക്ഷേ വേണ്ടി വന്നാൽ വരേണ്ടി വരും എന്നുള്ള കോണ്ടെക്സ്റ്റാണ് വരുന്നത് അല്ലേ. അപ്പോൾ അവിടെ ഒരു പക്ഷേ എന്നുള്ളൊരു കോണ്ടെക്സ്റ്റ് വരുന്നത് കൊണ്ടാണ് നമ്മൾ ഹവർ എന്ന് പറഞ്ഞ യൂസേജിലേക്ക് പോയത് കേട്ടോ. സോ ഐ ഹോപ്പ് ദാറ്റ് is clear. അപ്പോൾ ഇങ്ങനത്തെ പോയിന്റ്സുകൾ തമ്മിൽ കണക്ട് ചെയ്യാനായിട്ട് you can try to use these points. Okay, so I hope you got the idea there. Okay, yes. Okay, Jubi, do you have any questions I can help you with? That's a very great transition question. Adira has mentioned, I understand you're concerned about home management. Don't worry, let me explain that to you. Great. Jubi, please don't worry. I understand that you have some doubts regarding the management. I can explain to you in detail, Jubi. നമ്മൾ കഴിഞ്ഞ ക്ലാസ്സിലും അത് നോട്ട് ചെയ്ത പോയിന്റ് ആണ്. എക്സ്പ്ലെയിൻ യു അല്ല, എക്സ്പ്ലെയിൻ ടു യു. Suma, is there anything else I can help you with? Great. And yes, Jubi, speaking about your sentence construction, it is really great. കേട്ടോ, നല്ല രീതിയിലുള്ള സെൻറ്റൻസസ് ആണ്. ആ ഒരു ചെറിയൊരു കറക്ഷൻ ഒന്ന് ശ്രദ്ധിച്ചാൽ മതി. ഓക്കെ, Akhil, do you have any concerns which I need to clarify? Excellent. Suma, using antibiotics would be good, but let me tell you, as of now, it is not off. Okay, as of now there is no severe infection confirmed. Now I can tell you immediate antibiotic is not necessary. Okay, instead of now I can tell you, you can simply use therefore. Okay, severe infection there is no severe infection confirmed, therefore immediate antibiotic is not necessary at all. That's fine. All right, so I hope all of you got an idea about how this can be done, and this is familiar as well. So from the beginning itself I told you this is a very common task type. ഈ ടോപ്പിക്സും ഈ ടാസ്കുകളും ഈ ഓർഡറും ഒക്കെ ഒത്തിരി നമ്മൾ ചെയ്ത് പ്രാക്ടീസ് ചെയ്തിട്ടുള്ളതാണ്. പക്ഷേ ഇത് റീസെൻ്റ്ലി എക്സാമിന് വന്നതുകൊണ്ടാണ് ഞാൻ അത് പിക്ക് ചെയ്തത്. സോ മേക്ക് ഷുവർ ദാറ്റ് യു ആർ ഓൾസോ പ്രാക്ടീസിങ് ഇറ്റ് ആൻഡ് മേക്കിംഗ് യുവർ സെൽഫ് ഫെമിലിയർ വിത്ത് ദീസ് കോണ്ടെക്സ്റ്റ്. ഓക്കെ, സോ യെസ്, ദാറ്റ്സ് ഓൾ ഫോർ ടുഡേ. I hope everything is clear. I hope everything is clear to you guys. Got an idea about how it can be organized, how things can be done, how the connections can be maintained, how you can get the information from the background information and club it with the task and things like that. So yes, I hope you got an idea about it. Okay, so thank you very much for the very constant messaging and the commenting down. It made me actually very interested in this entire segments, because I can read and then connect with you and give you the corrections here. So it was great. So thank you very much for your patience. So I'll be coming back tomorrow, which is Wednesday, with the mock presentation and also the discussion afterwards. Okay, so stay tuned. I'll talk to you guys tomorrow. Good night, all of you. Bye bye.